Hello there. Welcome back to KMBP Entertainment. In this video, we're going to view interesting facts on the coronavirus. Make sure to like this video, share it, and subscribe to the channel. Coronavirus is an infectious disease caused by a newly discovered strain of coronavirus, a type of virus known to cause respiratory infection in humans. This new strain was unknown before December 2019 when an outbreak of a pneumonia of unidentified cause emerged in Wuhan, China. The common symptoms of coronavirus are cough and fever. The less common symptoms are sore throat, diarrhea, headache, loss of taste or smell. Serious symptoms of coronavirus are difficulty in breathing or shortness of breath. Sneezing and runny noses are not common symptoms of COVID-19. It's a misconception that nasal symptoms are common. Instead, the most common symptoms are fever and a dry cough. Have you ever wondered how coronavirus COVID-19 enters your body? The virus circulates through droplets in the air spread by coughing or sneezing and enters the body through the mouth, eyes, or nose. After entering the body, the virus spreads to the back of the nasal passage and to the mucous membrane in the throat, attaching to the body's cell receptors. The virus copies proliferate, break out of the cell, and infect other cells in the body. A single cell can churn out millions of copies of the virus before it dies. The infection can then reach the lungs, causing inflammation in their mucous membranes and damaging their air sacs. Now let's move on to fact number 1. Many people who became infected, 18% or 1 in 5 people, do not even have a cough. The disease proceeds without any symptoms at all. A person may not even suspect that he's sick. Asymptomatic transmission refers to transmission of the virus from a person who does not develop symptoms. It took asymptomatic people 17 days to test negative for the virus. After diagnosis, it took symptomatic people 19 to 20 days. Now let us move on to fact number 2. It can take up to 11 days for symptoms to appear after infection. The incubation period of COVID-19, which is the time between exposure to the virus and symptom onset, is on average 5 to 6 days, but can be as long as 14 days. Thus, quarantine should be in place for 14 days from the last exposure to a confirmed case. Now let's view some frequently asked questions and their answers. Can the coronavirus survive on surfaces? It is not certain how long the virus that causes COVID-19 survives on surfaces, but it seems likely to behave like other coronaviruses. The survival time depends on a number of factors, including the type of surface, temperature, relative humidity, and specific strain of the virus. What are some good foods to eat during the COVID-19 pandemic? You should eat a variety of fresh and unprocessed foods every day to get the vitamins, minerals, dietary fiber, protein, and antioxidants your body needs. Drink enough water, eat fruits, vegetables, legumes, for example lentils and beans, nuts, and whole grains. Who's at risk for coronavirus? Evidence to date suggests that two groups of people are at higher risks of getting severe COVID-19 disease. These are older people, that is people over 60 years old, and those with underlying medical conditions. To prevent the spread of COVID-19, clean your hands often. Use soap and water or an alcohol-based hand rub. Maintain a safe distance from anyone who is coughing or sneezing. Wear a mask when physical distancing is not possible. Stay home if you feel unwell. Hope you all enjoyed our video. Please leave your valuable comment in the comment section. We will be back with more interesting content in our upcoming videos. Stay tuned!